My talk this evening is going to be kind of focusing on some of the issues with regard to retirement. I'm having trouble hearing, I'm sorry. Is that better?
Yes.
Thank you. And one of the things that I always like to discuss is planning with regard to your retirement and looking at your Social Security options. And you basically have three choices. You can retire early and take a reduction in what your normal benefit would be. You can choose to retire at your normal retirement age, which, depending on the year you were born, can obviously vary. Or you can choose to retire later and postpone retirement. And in doing that, there are perks in waiting, in that your Social Security income will be increased in that waiting process. The considerations of retirement, when is it right? There's lots of things to think about. Obviously, you could be looking at lower monthly income. So you want to think about what your fixed cash needs are going to be. What are your fixed expenses? Kind of do a little budget and look at what those costs are going to be. And then think about what your income sources are going to be. You might have Social Security coming in, you might have some investment income, through IRAs or a 403B if you work for a nonprofit, or a 401k, or some annuities that you might have started when you were younger. And looking at what that income potential is going to be. You can consider still working once you start drawing Social Security. There's parameters in which you have to be aware of, but that's certainly an option. You have to think about your health, and you have to think about, if you're married, your spouse's health. Does it make sense to postpone retirement if you're in ill health? People have to really sit down and think about that long and hard sometimes. There's creative ways to plan your Social Security retirement. If, let's say you have a spouse who is a lower income earner, they might choose to retire at age 62, or retire early. And then you might have the higher income earner wait until age 70. And that way you have one person who's drawing that lower amount, and then once that other person retires, then their retirement's going to be higher. And of course, while they're waiting to retire, they're still an income earner to help balance out everything. It's called a 62-70 split strategy. You have to think about your known expenses, and then the unforeseen expenses. Your Medicare B premium is based on your income. If you're a higher income earner, the Medicare B premiums are going to be affected. Think about your taxes. You have to think about inflation. There's obviously a lot of considerations. In thinking about investment strategies, when you're planning, and obviously the closer we get to retirement, the more conservative we want to be. You want to have a goal of a steady income stream, but you want to be able to preserve what capital you have so that you're not depleting it with your income stream that's coming in. So you also have to be mindful of having some appreciation. So there's a fine balance between being super conservative or still having a little bit of growth potential so that you're able to keep up. We're certainly living longer, and we want to be able to enjoy our lives. Obviously, diversification. There's strategies with using bonds that have different maturity dates as an income stream. Income-producing real estate, whether it's a real estate investment trust or it's rental property that you might own, or investing in mutual funds that are concentrating in the real estate. Using blue chip stocks, the tried but true stocks, so that you're going to have that safety net. We like to look at a percentage of what you're going to be withdrawing each year to make sure that you're not going to run out of funds. Thinking about health insurance, the rising cost of health care. Again, our medications are getting more and more expensive. I've mentioned this at every meeting. It's Medicare D, open enrollment. So if you're currently on Medicare and you're using prescription drugs, now's the time to do your Medicare D check. Certainly a lot of the plans, their drug formularies change, so it's really important that you have that evaluated. That's something that we do as a courtesy for our clients. I don't sell Medicare D products, but we assist our clients with them. We do take care of Medicare supplementals. But you have to think about your Medicare A, which is free for most, I would say 95%. And then Medicare B, which you're going to be paying a premium for. You would have Medicare supplementals that you need that cover the gaps. There's Medicare Advantage plans, which are Medicare HMOs, where you basically give up your Medicare, traditional Medicare, and you're with a fixed insurance company. The associated costs with regard to your health care, as far as the prescription drugs, doctors, services, things of that nature, you need to be aware of because they're ever changing. Medicare A is what typically covers hospice, but Medicare does not cover long-term care. Long-term care is defined really not as skilled care, but when you need assistance with activities of daily living. So dressing, transferring, toileting, bathing, cognitive abilities, eating, feeding yourself. Those are the types of things that a long-term care policy are able to assist you with. There are traditional long-term care policies where you pay a premium. Some of them have the ability to have a return of premium rider that's put on them, although that's becoming quite expensive. There used to be 10-pay policies where you could purchase them in your higher income earning years so that you paid for 10 years, and then at the end of that time you were done, you had a paid in full policy. They've pretty much gone by the wayside, which is really, really unfortunate. That's probably the most popular product that I sold because you're trying to, they're expensive, and just like with your car insurance or your homeowner's insurance, if you never use it, if you don't have that return of premium on it, it's gone. So those 10-pay policies, even though they were expensive, at least you were kind of limiting that, I don't want to say agony, but that premium payment. There are some very creative ways to cover long-term care. There are life insurance products that have riders built into them where you're able to pull out a percentage of that life insurance policy to cover the cost associated with long-term care. Which right in this day and age, for not a super high-end facility, you're close to $300 a day. Home care is even more expensive. So having a life insurance product or looking at a life insurance product that might have a long-term care rider, underwriting for that type of a product is going to be more liberal, and it enables you to kind of throw away that mindset of, well, if I never need long-term care and I've paid this premium, it's gone. With a life insurance product that has that long-term care benefit, if you never need the long-term care aspect of it, there's a death benefit for your family, which can be used to assist with estate planning and helping your family. So certainly something to consider. Medicare does not cover custodial care. It will cover skilled care after you've met very specific criteria, 3 days in a hospital, and it becomes quite not problematic, but quite challenging. So certainly an independent long-term care policy is something to consider. They also, there's products where it's a single pay, so you're paying a lump sum, and again, there's a death benefit. So if you never use it for long-term care, there is still a benefit to that product. There are partnership plans here in Maryland, so if you do purchase a long-term care policy, and it might not cover all of your needs, because the policies can be limiting based on what you're able to afford and what products are out there, but they will allow you to reduce what you have to spend down to be eligible for Medicaid. It's kind of a dollar for dollar what you've spent for coverage of long-term care, whatever that benefit amount is, you're able to retain those assets, which is wonderful for your family, or if there's certainly something to consider. And then, if it's a tax qualified plan, there's other benefits and there's other requirements to those types of products. And I'll end with this kind of little statement. The National Retirement Risk Index, sponsored by Boston's College Center for Retirement Research, found in March of 2010 that 65% of retirees were at risk of not maintaining their style of living in retirement when health care and long-term care were included in their needs and assets assessment. So something to certainly think about. Thank you.